Gingivectomy is a dental surgical procedure involving the excision of the soft tissue wall of a periodontal pocket. This technique is primarily used to remove diseased gum tissue and reduce pocket depth, ultimately improving oral health. Unlike gingivoplasty, which focuses on reshaping the gum for aesthetic or functional reasons, gingivectomy is about eliminating problematic pockets. Understanding the difference between these two procedures is essential for both dental professionals and patients. In this video, we'll explore the prerequisites, indications, contraindications, and the various techniques used in gingivectomy, guiding you through each step and highlighting important considerations for optimal outcomes. Gingivoplasty is a related but distinct dental procedure. Instead of removing gum tissue to eliminate pockets, gingivoplasty focuses on recontouring the gingiva that has lost its natural shape. This is often done to restore the physiologic form of the gums, especially after disease or trauma has altered their appearance. The goal is to create a more natural, healthy-looking gum line, which can also improve oral hygiene by making it easier to clean around the teeth. Gingivoplasty does not address deep periodontal pockets, but it plays a crucial role in cases where the gum's shape needs correction for function or aesthetics. Before performing a gingivectomy, certain prerequisites must be met to ensure the procedure's success and patient safety. There should be an adequate zone of attached gingiva, so that even after excision, a functionally sufficient amount remains. The underlying alveolar bone should be normal, or nearly normal in form, and if bone loss is present, it should be horizontal rather than vertical. Importantly, there should be no infrabony defects or pockets. These conditions help minimize complications and promote proper healing after the surgery. Gingivectomy is indicated in several clinical situations. It is used to eliminate supra-alveolar pockets and abscesses, remove fibrous or edematous gingival enlargements, and transform rolled or blunted margins into a more physiologic form. The procedure can also enhance aesthetics, especially when the anatomic crown is not fully exposed, and create bilateral symmetry. Additionally, gingivectomy can expose more clinical crown for restorative procedures and correct gingival craters. These indications make it a versatile tool in periodontal therapy. Not every patient is a candidate for gingivectomy. Contraindications include the presence of thick alveolar bone edges, interdental craters, or unusual crestal bone forms. Infrabony pockets, pockets extending to or below the mucogingival junction, and inadequate oral hygiene are also reasons to avoid the procedure. Other contraindications include uncooperative or medically compromised patients, dentinal hypersensitivity before surgery, and aesthetically sensitive areas, particularly in the maxillary anterior region. Careful patient selection is crucial for successful outcomes. There are several types of gingivectomy, each suited to specific clinical scenarios. The main types include surgical gingivectomy, electrosurgical gingivectomy, laser gingivectomy, and chemosurgical gingivectomy. Each method has its own advantages, disadvantages, and indications. Understanding these types helps clinicians choose the most appropriate approach for each patient, balancing effectiveness, safety, and patient comfort. The surgical gingivectomy procedure requires a specific set of instruments to ensure precision and safety. These include a mouth mirror, periodontal probe, pocket markers, Kirkland and Orban interdental gingivectomy knives, surgical blades with barred Parker handles, surgical and Gracie curettes, tissue forceps, scissors, and periodontal dressing materials. Each tool plays a vital role in the different steps of the procedure, from marking the pocket depth to excising tissue and ensuring proper wound coverage. The first step in surgical gingivectomy is to explore and mark the periodontal pockets. Using a periodontal probe, the dentist identifies the depth of each pocket, then uses a pocket marker to puncture and mark the bleeding points at the base of the pocket. This step is crucial for guiding the incision and ensuring that all diseased tissue is targeted during the procedure. Accurate marking helps prevent unnecessary removal of healthy tissue and sets the stage for a successful outcome. After marking the pockets, the next step involves making precise incisions using periodontal knives, Bard Parker blades, and scissors. The incision starts apical to the marked points and is directed coronally, aiming for a point between the base of the pocket and the crest of the bone. The incision should be beveled at about 45 degrees to the tooth surface, recreating the normal festooned pattern of the gingiva. This careful approach helps avoid unnecessary bone exposure and promotes faster, more natural healing. Once the incision is complete, the excised pocket wall is carefully removed. The area is then cleaned, and the root surface is closely examined for any remaining deposits. This step ensures that all diseased tissue is eliminated and that the root is free of calculus or other debris, which is essential for proper healing and the prevention of future periodontal problems. After removing the excised tissue, the dentist uses curettes to carefully remove any granulation tissue, calculus, or necrotic cementum from the root surface. The goal is to leave a clean, smooth root that will support healthy gum reattachment and healing. This meticulous cleaning is a critical step in preventing recurrence of periodontal disease and ensuring long-term success. The final step in surgical gingivectomy is to cover the treated area with a periodontal surgical pack. This pack protects the wound, helps control bleeding, and supports the healing process. It also provides comfort to the patient during the initial recovery period. Proper placement and retention of the pack are important to prevent complications and promote optimal healing. Gingivoplasty is performed to reshape the gums for improved aesthetics and function. Instruments used include periodontal knives, scalpels, diamond stones, or electrodes. The procedure involves tapering the gingival margins, scalloping the marginal outline, thinning the attached gingiva, and creating vertical interdental grooves. The interdental papillae are shaped to provide sluice ways for food passage, reducing the risk of food impaction and promoting oral health. Gingivoplasty is indicated for cases with grossly thickened gingival margins, clefts, and craters caused by necrotizing ulcerative gingivitis, irregular gingival margins in adjacent areas, and saucer-shaped defects in the interdental regions. By addressing these issues, gingivoplasty helps restore a healthy, natural-looking gum line and supports better oral hygiene. Healing after surgical gingivectomy follows a predictable pattern. Initially, a protective surface clot forms over the wound. This is soon replaced by granulation tissue, which is rich in new connective tissue cells, especially angioblasts. By the third day, numerous fibroblasts populate the area, and highly vascular granulation tissue grows coronally, forming a new free gingival margin and sulcus. Capillaries from the periodontal ligament migrate into the granulation tissue, connecting with gingival vessels within 2 weeks. Surface epithelialization is generally complete after 5 to 14 days, though full keratinization may take about a month. Electrosurgery, also known as surgical dithermy, uses high-frequency electrical currents to cut or coagulate tissue. The current typically ranges from 1.5 to 7.5 million cycles per second. This technique offers precise tissue control and effective hemostasis, making it a valuable tool in certain periodontal procedures. However, it requires specialized equipment and training to avoid complications. There are 3 main classes of electrodes used in electrosurgery: single-wire electrodes for incising and excising tissue, loop electrodes for planning tissues, and heavy, bulkier electrodes for coagulation procedures. Each type is designed for a specific function, allowing the clinician to tailor the procedure to the patient's needs. Proper electrode selection is key to achieving the desired surgical outcome. 4 main electrosurgical techniques are available: electric section, electrocoagulation, electrofulguration, and electrodesiccation. Electric section involves incising, excising, and planning tissue. Electrocoagulation is used to prevent hemorrhage. Electrofulguration uses high voltage current and has limited dental application. Electrodesiccation, which uses a dehydrating current, is rarely used due to its potential dangers. Each technique serves a unique purpose in surgical practice. During electrosurgery, the active electrode is inserted into the tissue. The surrounding tissue is coagulated in situ, which helps control bleeding and shape the surgical site. This method is particularly useful in dermatological and cancer surgeries, but it can also be applied in periodontal procedures for specific indications. However, care must be taken to avoid excessive tissue damage. Electrosurgical gingivectomy offers several advantages. It allows for precise contouring of the gum tissues and provides excellent control of bleeding during the procedure. This can make the surgery more efficient and comfortable for both the patient and the clinician. Additionally, electrosurgery can be especially useful in cases where traditional surgical methods are challenging. Despite its benefits, electrosurgical gingivectomy has some disadvantages. It cannot be used in patients with poorly shielded cardiac pacemakers due to the risk of interference. The procedure may produce an unpleasant odor, and accidental contact with bone can cause irreparable damage. Additionally, the heat generated can lead to tissue damage and cemental necrosis, so careful technique is essential. Electrosurgical gingivectomy is indicated for the removal of gingival enlargements, performing gingivoplasty, relocating frenum and muscle attachments, and incising periodontal or pericoronal abscesses. Its ability to control bleeding and precisely shape tissue makes it suitable for these specific clinical situations. For gingivoplasty, needle electrodes and diamond-shaped electrodes are used to festoon the gum margins. In reshaping procedures, the electrodes are activated and moved in a concise shaving motion. For abscess drainage, needle electrodes make precise incisions, while a ball electrode is used for hemostasis. Loop electrodes are employed for relocating frenum and muscle attachments. Each technique is tailored to the specific surgical goal. Healing after electrosurgical gingivectomy is generally similar to that after traditional surgery. However, some studies report delayed healing, greater reduction in gingival height, and more bone injury following electrosurgery. Close monitoring and proper technique can help minimize these risks and promote optimal recovery. Laser gingivectomy uses CO2 or YAG lasers to excise overgrown gingival tissue. While lasers offer precision and reduced bleeding, their use in periodontal surgery is not widely supported by research. More studies are needed to establish their long-term safety and effectiveness in this context. Chemosurgical gingivectomy involves the use of chemicals such as 5% paraformaldehyde or potassium hydroxide to remove gingival tissue. While this method can be effective, it has significant drawbacks, including the inability to control the depth of action, risk of injury to healthy tissue, and delayed healing. Additionally, gingival remodeling is not possible with this approach. Comparing surgical and electrosurgical gingivectomy highlights key differences. Surgical methods use manual instruments and are suitable for most patients, while electrosurgery offers better bleeding control but is contraindicated in some cases. Electrosurgery may also cause more tissue damage if not performed carefully. The choice depends on patient factors, clinical indications, and practitioner expertise. Selecting the right patients for gingivectomy is essential. Candidates should have adequate attached gingiva, no infrabony defects, and good oral hygiene. Contraindications must be carefully considered, including medical conditions, anatomical limitations, and patient cooperation. Proper assessment ensures safety and maximizes the chances of a successful outcome. Before performing gingivectomy, thorough preoperative preparation is necessary. This includes a comprehensive dental examination, radiographic assessment, and evaluation of the patient's medical history. Oral hygiene instructions should be reinforced, and any existing infections or inflammation must be managed prior to surgery. Proper preparation reduces the risk of complications and supports optimal healing. After gingivectomy, proper post-operative care is crucial for healing. Patients should follow instructions regarding oral hygiene, avoid trauma to the surgical site, and attend follow-up appointments. Analgesics and antimicrobial rinses may be prescribed to manage discomfort and prevent infection. Monitoring for signs of delayed healing or complications is important for a smooth recovery. While gingivectomy is generally safe, complications can occur. These include excessive bleeding, delayed healing, infection, and, in rare cases, damage to underlying bone or teeth. Prompt recognition and management of complications are essential to ensure patient safety and successful outcomes. Patients should be educated about warning signs and encouraged to seek care if problems arise. Gingivectomy can provide significant restorative benefits. By exposing more of the clinical crown, it allows for better retention of crowns, bridges, or other restorations. This is especially important in cases where the natural tooth structure is insufficient for proper restoration. The procedure can also improve the overall aesthetics of the smile. Beyond functional benefits, gingivectomy can enhance the appearance of the gums and teeth. By reshaping the gum line and correcting irregularities, the procedure creates a more balanced and symmetrical smile. This is particularly valuable for patients concerned about the aesthetics of their teeth and gums. Gingivectomy is effective in correcting gingival craters, which are depressions in the gum tissue often caused by disease or trauma. By removing the diseased tissue and reshaping the area, the procedure restores a healthy contour and prevents further periodontal problems. This contributes to both functional and aesthetic improvements. Creating bilateral symmetry is another important indication for gingivectomy. By carefully excising and reshaping the gum tissue, clinicians can achieve a more harmonious and attractive smile. This is particularly important in cosmetic dentistry, where even minor asymmetries can affect the overall appearance. Gingivectomy is particularly useful for removing fibrous or edematous enlargements of the gingiva. These enlargements can result from chronic inflammation, medications, or systemic conditions. By excising the excess tissue, the procedure restores normal gum contour and improves oral hygiene access. Rolled or blunted gingival margins can be transformed into a more physiologic form through gingivectomy. This not only improves the appearance of the gums, but also helps prevent food impaction and supports better oral health. The procedure is tailored to recreate the natural festooned pattern of the gingiva. In some cases, the anatomic crown of the tooth is not fully exposed due to excessive gum tissue. Gingivectomy can be performed to reveal more of the crown, facilitating restorative procedures and improving aesthetics. This is especially beneficial when additional retention is needed for crowns or bridges. Gingival craters, often resulting from necrotizing ulcerative gingivitis or trauma, can be corrected with gingivectomy. The procedure removes the cratered tissue and reshapes the area, restoring a smooth, healthy gum contour. This not only improves aesthetics but also reduces the risk of recurrent infection. Gingivectomy can be used to manage periodontal and pericoronal abscesses. By incising and draining the abscess, the procedure helps eliminate infection and promote healing. Electrosurgical techniques may be particularly useful for precise incision and hemostasis in these cases. In some cases, the frenum or muscle attachments may interfere with oral function or aesthetics. Gingivectomy, particularly with electrosurgical techniques, can be used to relocate these attachments, improving both function and appearance. Loop electrodes are commonly used for this purpose. Controlling bleeding during gingivectomy is essential for visibility and patient safety. Electrosurgical techniques, especially with ball electrodes, are highly effective for achieving hemostasis. Proper technique minimizes blood loss and supports a clear surgical field, contributing to a smoother procedure. Delayed healing can occur after gingivectomy, particularly with electrosurgical or chemosurgical techniques. Factors contributing to delayed healing include excessive tissue removal, thermal injury, or poor post-operative care. Recognizing and addressing these risks early helps ensure a successful recovery. Chemosurgical gingivectomy is limited by its inability to control the depth of tissue removal. This can result in injury to healthy tissue and delayed healing. Additionally, this method does not allow for gingival remodeling, making it less suitable for cases where precise contouring is needed. Gingivectomy is a versatile periodontal procedure with applications in pocket elimination, aesthetic improvement, and restorative dentistry. Understanding the indications, contraindications, and various techniques, surgical, electrosurgical, laser, and chemosurgical, is essential for optimal patient care. Proper patient selection, technique, and post-operative management are key to achieving successful outcomes and minimizing complications. Always consult with a dental professional to determine the best approach for each individual case.